So quick question. Have you ever had labs drawn and everything comes back normal, but you're really feeling anything but normal? Even when your blood chemistry, the report comes back and everything considers to be within normal limits, this report can really provide you with valuable information, okay? Even when everything looks normal. When you interpret it from a functional perspective, there is a difference. There's a difference between the conventional method approach to analyzing labs and the functional method and that approach to analyzing labs. So I want to just give you a little insight on what the difference is. Both are very useful, but conventional medicine really uses a broader range. It identifies disease, it tracks medications that people may be on. So a very broad reference range, okay? And when we're looking to identify disease and pathology, that's really what conventional medicine is doing. All right. And also you may be on pharmaceuticals that are treating abnormal markers and they need to be tracked as. So functional medicine approach to analyzing labs really has a tighter range. It really identifies subtle changes and catches the dysfunction early. It uses much tighter ranges, and when you're able to get those subtle changes in check, you can really look at things before they happen and kind of get a grasp on it. So it attempts to catch that dysfunction early so that it can be corrected. Now, lifestyle and natural supplements can be recommended to restore balance in the body. What happens with a lab report when it's being analyzed? When a lab report goes to a lab, each lab's reference ranges in conventional medicine can be very different from lab to lab, company to company, and state to state. Why is this? The reference ranges are based on average populations in that area. The issue with this is that the average population is not typically well. We're not in optimal health. Therefore, it's not pointing you toward optimal health. Even when the lab results are flagged as normal, and even when they're normal, they may be a high normal or a low normal, which is outside of the optimal range. And this can indicate that imbalance that I talked about, and it really disrupts homeostasis. Now, homeostasis is your body being in that nice balanced state, okay? Now, using the optimal functional range to interpret a lab report, as I said, it uses tighter ranges because the values are not associated with disease or major dysfunction. By not looking at it from this tighter lens, this functional lens, you're really missing the opportunity to address any of these subtle dysfunctions before it turns into disease, before that snowball effect happens. So any marker that's not optimal can tell us a story. It really helps us to dig deeper. And if we can identify roots early, then we can really avoid that snowball effect. What I mean by being normal but not optimal, you see, there's 3 levels of normal. If we've got that value that you see on your lab report in conventional medicine that says within normal limits. However, as I said, you can be a high normal or a low normal. And so with that functional range, it's the optimal range. It's that range in the middle. It's tighter. And so the conventional normals can be outside of this, and that indicates the imbalance and possible dysfunction. And if you don't correct it, yes, the snowball leads to that dis-ease within the bodies. I do want to be clear that lab values are really just a snapshot in time. And so what's more important is looking at the trends. However, by meeting yourself where you are, you can really begin to make strides in your wellness, on your journey, put goals into place and take action. So if this video gave you any insight into how functional lab analysis can help you see where your focus should be and really help you better understand what's going on in there and the difference between looking at labs through a conventional lens versus a functional lens. Follow for more helpful tips on supporting your health and wellness. And I'll see you next time.